So I guess what would you say to those people who? Let's go to the beginning. So can you tell us more about the pre-registration process?
Yeah. So before we, when we had the August 15th community testing, we saw an overwhelming amount of people that showed up. Right. We had nearly 1,500 people that showed up. It created a backlog, and that resulted in delayed results being delivered to the patients that showed up to that community testing. And we don't want to repeat that. So we shifted our focus to targeted testing for those who were symptomatic. We wanted to focus on certain groups, high-risk groups. And so we decided that, for future community testings, and we wanted to test it out specifically for the upcoming one, which is today in Talofofo. We wanted to see how it would turn out if we limited it to the first 200 pre-registered people. So we worked with the Talofofo community, Talofofo Mayor's office, and we asked them to announce it to their residents to see if we can get the first 200 people. We announced it in the JIC, and immediately we saw people just calling in and registering. It capped at 200, and I think within the first day or two, we saw it get full right away. For the next community testing, we haven't decided yet, so we're going to see how this turns out. And like today, we've only seen the first 100, as Dr. K had mentioned. We're still waiting for the next 100. So, who knows what will happen today? We'll make that decision, down the road for the next community testing, which I believe is on September 19th.
So we're hearing from some residents who had called 311 and they were told to just come down and get tested. And then we're talking with the Talofofo Mayor's office. It looks like they didn't get much of a heads up. So I guess, again, just moving forward, how are you going to better publicize the testing availability if we're going to limit the number of people that can get tested?
Well, we do have a couple of weeks to plan and strategize for the next community testing. So, things change, plans can change, and hopefully we learn a little bit more, a little bit better as things move along. But as Dr. K had mentioned, there is available testing for the community. We do have our Northern Region Community Health Center. So if we do have patients who are symptomatic and needing testing, they can call and contact and schedule an appointment. We have our Tier 2 clinic partners, so they can call and get tested there if they're feeling symptomatic. So it's not like there's nothing available to them as a resource. So there's always something available. If you need to get tested and you're feeling ill, you can always call 311. You can visit one of our Tier 2 clinics if you're feeling symptomatic. So there's no limitation. If you really need to get tested, there is availability for our community.
What about those people who are not symptomatic but want to get tested because of the rising number of cases and don't have insurance or otherwise compromising their ability to pay for the testing?
So right now our focus is on, we've shifted our focus because we don't want to overburden and overwhelm. We don't want to repeat what happened in the past. So our focus is, again, it's on high-risk groups, it's on contact tracing, and we saw what happened in the past when we opened it up to just community-wide mass testing. When we did that from April to July, what the numbers indicated was we weren't getting a lot of positives. So if there's a concern that you may have been exposed but you're not a close contact, what we really recommend for people to do is really just self-monitor. Self-monitor yourself, look out for signs and symptoms of COVID, shortness of breath, cough, fever, and if those symptoms do start to show, then you can call 311, call your physician. And in the meantime, we always encourage people, wear your mask, social distance. Those are the key measures to take to prevent, COVID, or to protect yourself and others in the community from spreading the virus.
Just one last question. So I know that, and we talked to public health about the previous community mass testing that you had mentioned, but at that time, right, we didn't have this, widespread prevalence of the virus. So do you think that community mass testing now would yield different results than it did before?
I think, with community mass testing, it's really sort of, it's changing because of what we're seeing in the numbers that have been happening in the last few weeks. As we shift toward targeting testing, and as we do more of it, we will, and as the experts have been saying, the more we test, the more we're going to see numbers increase. It's hard to say because in the past, as we did community-wide testing, as we opened it up to anyone and everyone who wants to come, we didn't see as the numbers that we were expecting to see. So it's really hard to say. But really right now it's just sort of, we just have to really focus on the high-risk groups because that's really where we want to capture the positive cases.
Thank you.